Evening, everyone. I am Councilwoman Joy Brenner, and I just would like to welcome you on behalf of our committee that put this together. And our committee was made up of members of the Homeless Task Force. And as we were meeting on the homelessness issue, we began to realize that there's so many different aspects of the problem, and people generally have a heart for helping the veterans, and they had a heart for helping families, and even a heart for helping those who are down on their luck. And the more we talked about it, the more we realized that the people that were most difficult for our community members to deal with were the ones who had mental health issues and the ones who had substance abuse issues. So our committee, I'm going to introduce, we only have 2 members of our committee here tonight because some are sick and others are committed, but Helen Cameron from Jamboree Housing is here. Helen works with permanent supportive housing, and they are busier than can possibly be because this is such a big issue, but they are actually coming up with solutions that are helping to get people off the street. The other member of our committee that's here is Dr. David Snow from UCI, and he's done the whole analysis of the homeless situation, and he was an integral part of our committee because he really had the data to support the things that we thought we were seeing in the community, the things that we thought we knew about homelessness, and the things that we realized we were thinking wrong about homelessness. So it was really interesting. And I'd like to thank you for coming out tonight because this has been such a brutal 4 days for our community. And I think that's probably why we're a little bit lighter tonight than we would have been otherwise, because we are all still struggling with the events of this Sunday and what happened. And I call it the community heartbreak because it's like we are all going through, and we're really struggling. And I actually, when I met our speakers tonight, I asked them if they have a chance to talk about this whole general heartbreak that we're all feeling, and any insights into that, because this is I've been in Newport for almost 60 years, and it's the most far-reaching impact of any horrific event that we've ever known at our level. And so anyway, so I appreciate you being here tonight. And I also wanted to say thank you to a critical member of our committee, who is Tom Peterson. Tom is the public information specialist for the County of Riverside and their mental health efforts. Tom was the one on our committee that reached out to his friends that he knew that are the experts on mental health, and Natalie is going to introduce them in detail for you, and then Tom got called into work tonight, so he couldn't be here, and he's really the one we should be thanking the most for putting this all together. I think I know that our schools sent crisis management teams to the schools that were most impacted by this, but that's what I was thinking. Maybe our experts tonight could give us a little bit of expertise on how you deal with people that are going through this level of crisis. So anyway, I would like to thank you again for coming and to introduce you to Natalie, who is our homeless coordinator and has just stepped into this job and learned so much about it and is now guiding all of the rest of us in what we do. Thank you.
Thank you, Councilwoman. This evening, I have the distinct pleasure of introducing our speakers. They're very accomplished in their fields, and we welcome them to be part of our broader conversation and city strategy on all the different ways we need to be looking at people experiencing homelessness, people that are vulnerable to experiencing it that aren't yet, and also to help our general community understand how if we help others, we're making a stronger and better community for all of us to live in. In my new role, I am looking at issues from a state level, a county level, a city level, a regional level, to make sure that we have regional partnerships in place to assist our people. I'm not going to give my full presentation. That is actually on NBTV already, if you'd like to view that. But what I would like to do is turn our program over to the experts, and they will be able to give us some insights. First, we have Dr. Clayton Chau. He is an MD and a PhD. He is the Chief Clinical and Strategy Officer for Mind OC. It is the nonprofit entity which he co-founded to support Be Well OC. It's a private, public, faith-based academic coalition which aims to transform the mental health system. He was previously with Providence Health System. Dr. Chow was actively involved in the development of the LA County Whole Person Care Program. He started his career in the public sector, working for 13 years with the Orange County Behavioral Health Services, where he was the director of the Center of Excellence in Education, Training, Research, and Advocacy for Reducing Health Disparities. He is also a lecturer for the UCLA School of Public Health and the UC Irvine School of Medicine. Dr. Chow obtained his MD degree from the University of Minnesota and his PhD in clinical psychology from Chelsea University. Finally, Dr. Chow has conducted international trainings on a variety of health topics. He's even featured in the 2013 documentary, A New State of Mind, Ending the Stigma of Mental Illness. Min Suh is an individual in mental health recovery, a professional with lived experience who has been with the Orange County Healthcare Agency's Behavioral Health Services since 2012. He spent his initial years in the role of peer support specialist before joining the Mental Health Services Act office in 2016, where much of his work focuses on peer workforce development and advising the behavioral health director and management on best practices for employing individuals with lived experience. Min serves on the Healthcare Agency's Peer Employee Advisory Committee and has previously served on the state's Mental Health Services Oversight and Accountability Commission's Client on Family and Leadership Committee. He holds a Master of Social Work degree from Cal State Long Beach. Heidi Sweeney is a mental health professional with the National Alliance on Mental Illness, Orange County, otherwise known as NAMI. You'll see that on the literature. She is a certified mental health worker. Heidi has received the Thomas Riley Service to the Community Award twice. She is actively volunteering and instructing in mental health and homeless support and advocacy programs. She serves as the lead trainer and instructor for the NAMI OC signature programs. Heidi is actively involved with multiple Orange County mental health organizations, including the OC Mental Health Agency Homeless Task Force and mental health support programs. She has journeyed with mental health for more than 23 years. And with that, I'd like to turn the program over to Dr. Chow.
Well, thank you so much for the invitation to come and speak to you all this evening. And I know, just like everyone in the community, I have family members that also struggle with the loss. This last weekend, I think Kobe has such a huge impact on all of us, not just in the U.S., but internationally. I don't know if you know, in China, the clip news on his passing since Sunday now has over 4 billion views. 4 billion. That's a huge number. And literally there are people who are sobbing, and they only knew him through the advertisement in China and the game that they watch on television, right? But especially youngsters are so much affected by that. And so a bit on what to do in healing is usually just like any other celebrity or people that we really admire because of their work in the community, particularly Kobe, if you know, he just has done a variety of programs for youngster, particularly young women across the state. The way to cope with that is to celebrate his good deeds and remember his good deeds and encourage our youngsters to continue his legacy, right? I think that's the best thing that we could do in healing. And the other piece is provides privacy for his family, and give them time to heal. Because sometimes saying thing or making comment also make it very difficult for the family to heal as well. So as a community coming together, we can do best by celebrating his work and his legacy rather than mourning the loss in a negative way. So that would be my offering. So I would ask Min and Heidi to say a few words if they can. I have a PowerPoint presentation to address the attempt in this county in transforming our mental health system, because there's still people probably heard of Be Well. Yes, who in the audience have not heard about Be Well Orange County? Oh my! Okay, we need to let you know what Be Well is. So I'm gonna do this presentation very quickly. I'm not gonna go through the details slide by slide because I want us to have a conversation. And I know we have till 7:30, so we have about an hour to have a meaningful community dialogue. Let's see. Sorry. Because the screen went blank. That's why I could do. Anyway, as you are well aware, currently mental health system anywhere, not just in Orange County, for the public side are actually very silos, right? We have the specialty mental health services that provide by the county Department of Behavioral Health for those who at the severe stage of their conditions, and then for people with Medi-Cal, public funded insurance, and then if your condition is mild and moderate, the responsibility is with the local Medi-Cal health plan, which is Optima. The issue there is, well, when am I mild and moderate, and when is it that I'm severe? So for those of people who are mild and moderate, this last weekend pretty much push you over to the sign of severe. So what does that mean, right? So there's always this issue of why did the government or legislatures silo the funding that way, because it's confusing. Then if you have private insurance, you're at the mercy of whatever the network that your private insurance would offer to you. So I would beg and said, for folks who have Medi-Cal, the county actually have lots of programs available if you know how to navigate it, right? Whereas for those people in the room who have private insurance, the access to care is an issue. And I don't have to tell you, you're probably constantly hearing on the news and how difficult it is to access mental health care, even when you have the insurance. And I would say that the best insurance there is Mr. Green. Right? So that's the best insurance. Even our veterans who're supposed to have better insurance coverage for healthcare than any one of us still struggle with accessing mental health, particularly if you live in Orange County, because we don't have a VA in Orange County. We have satellite clinics. And so about less than 3 years ago, April 2017 to be exact, a small group of us came together and asked a question. So there were about 15 of us, and a few of you in the room were part of that. Helen's particularly was in the room, and Nami absolutely participated in that conversation as well. So we posed the question, do we believe that we have a mental health system? And we looked at each other and we said, no, we don't have a system. Is there a need to build a system that would be responsive to all Orange County residents, regardless of what plastic car, meaning insurance card, that you carry in your pocket? And the answer is a resounding yes. So the Coalition of the Willing, we were first called, got together, and we said we're going to embark ourselves on a journey of building a a new mental health system of care for all residents here. And that coalition of the willing was the first time where the public and the private, the academic and the faith-based and advocacy group all came together. It took us years to build trust, and I'm going to say it as it is, because historically you've got an entity that pointing finger at each other and said, well, it's your responsibility or it's your responsibility, and so people fall through the crack. So it took about a year to build trust, and then a years to propose what that system of care would look like. And certainly miraculously it works, right? It always does that. And so we want to move towards that. So the coalition moved towards a community of action. Basically, we didn't want a top-down approach to it, but we want a community that come together using the collective impact model, which is an evidence-based model that developed by Stanford University a decade ago. And how do you drive a community of different sectors and different stakeholders to come together to solve one issue? And this model now, since the development a decade ago, has been studied inside out, upside down, and has been adopted by over 150 countries in the world. And so in Orange County, we base our coalition work on this collective impact model. What it does is it speak to people who are doing different things, doing the same thing, but in silos to come together, right? So I would say that in Orange County, it's not that we don't have excellent services, we do. We actually have many silos of excellence. And the saying that I've always said is, the more excellent the silo become, the thicker the wall become, and then it's harder to penetrate. And there's no way they will communicate with each other, right? Because in order for me to be excellent, I have to stand alone and stand out. If I mingle with you all, I no longer become the excellence. And so that's one issue. The second issue is most of the time we compete for fundings, right? And so I'll give an example. The county does stigma reduction via Each Mind Matters. So the county put funding into Each Mind Matters, which is a state programs that been advocated and built by the state. Well, the health system that I worked for back about less than a year ago, Providence St. Joseph Health System, as you know, one of our hospitals in South County also pay for Each Mind Matters. And then one of our hospitals in the same system up in North County also pay for Each Mind Matters. Weren't aware that their sibling in South County doing this. So when the three entities come together, the county, the two hospital within the system come together, and I posed a question, so how do you know Each Mind Matter works in Orange County? And they all look at me like, well, what do you mean? And I said, well, do you all measure success the same way? And obviously the answer is not, right? And so what the collective impact does is getting people who doing the same thing differently to come together to keep each other accountable for what you do, but remain excellent in your own way. And then count success based on the community input. That's the whole purpose of that. Okay, so the vision of the coalition of the willing is to lead the nation in optimal mental health and wellness for all residents. Now, when we say mental health, I want you to understand that we mean mental health and addictions, or mental health and substance use disorder, or mental health and substance abuse disorder. Okay. So when I say mental health, I'm not ignoring the substance use side. It is important. There's a whole issue on mental health, behavioral health that it would take another lecture to go through it because it's pretty controversial right now. In fact, I'm going to give you a hint. Very soon, within this year, next year, you will see the term mental health probably go away and replaced with brain illnesses or brain disease, because these are brain disease, from addiction to other mental health condition, ADHD, depression, bipolar illness, and what have you. They are all brain disease. And until we treat them as brain disease, we'll always fall short. By that I mean, if you look at the number of people who have mental health condition that are getting treatment, on the average in this country, only about a third or a little bit more than a third of those folks who have mental health condition are receiving minimally adequate treatment. Now, if you flip that around and you place that condition with cancer or HIV, the community would be devastated. Can you imagine if we said only a third of people in the United States have cancer, are receiving minimum adequate treatment? How do you feel? You would be outraged. You would be so angry that I can't even hold you in your seat. But why is it okay for people with these brain disease? So speak to the stigma of it, right? So that's what we set out to do. There's multiple prong and approach to how we're going to transform the mental health system here in Orange County. So the ecosystem that we have today, is different silos of excellence that happening all over the places. In fact, my partner, Marshall, has a blank slide between this ecosystem today, and then it go to, do we really have a mental health system? And it's supposed to be a blank slide telling us that no, there isn't a system. So I apologize. I don't know how I missed that blank slide, because you will see the effect. Okay, and this is the goal. Our goal is to put all of those pieces, connect all of those silos together into a system that makes sense for the end user. Those are the consumer, the family, right? Because right now, I'll give you an example. If you are in crisis, the county system has over 15 numbers for you to call. And your insurance has a number, and you call, and usually the person on the other line won't know how to help you. And then they'll say, call 911. Am I right? So the county system is so complicated that by the time you're in crisis, we can't even remember 5 number, let alone a 10 number digit. So we call 911. Hence the movement nationally to move our current national suicide lifeline, a 10-digit number, to a 3-digit number. I don't know if you're aware of that. So there will be a transition period sometime this year. By next year, this national suicide lifeline 10-digit number will be converted to 988. So that's coming, okay? Because in crisis, you don't remember the number. The easiest number is 911. And if you call 911, you know what happened, right? You get taken to a local emergency room, and you sit in there. You are so disturbed and depressed, and now you're taken into an environment that stir you up even more. Do you agree? You should say, no, I disagree with that. So we need to find a condition, a better solution for it. So that's in the horizon. Currently, we have over 150 entities participated in this coalition. Now have a full name called Be Well Orange County. This list is not updated. I didn't have time. I didn't know that I was supposed to send in a PowerPoint presentation until yesterday. So I gave you the outdated slide. I'm not going to go through this. If you're interested in the blueprint, I give me your business card or email address. I'll send it to you, or you can go on www.beweloc.org. Okay? Don't go to .com. Now, I have to tell you, before, a month ago, if you go to .com, you will be brought to a porn site. We took care of that, so there's no longer a porn site, but it doesn't exist. So you need to do, well, I know, and you never know. Last time I checked, they weren't there, but if you have money, you can do anything. Maybe there's even a worse site that's on there, but we are .org. So www.beweloc.org. So the information on our blueprint is there, so I'm not going to walk you through a blueprint. But basically, this is the distributed leadership via the collective impact. So all the entity participate in this. So this is what I usually say when people ask me, so who owns Be Well? So my answer is, nobody owns Be Well, but all of the 150 organizations that participate in this all own Be Well. Does that make sense? So it is a movement. But we quickly realize that that movement has to have some financial structure to support it. And so the Mind OC is a 501c3, a nonprofit organization that was founded. Its sole purpose is to align funding, align policy, align program to drive the work of Be Well. So my OC is not a service provider. It's not a clinic. All right? So you got it now, right? So 5-second elevator speech. What is Be Well and what is My OC? Be Well is a movement in Orange County, and My OC is a nonprofit that was founded to drive the work of Be Well. There has never been an entity like this anywhere in the United States. We're the first one. Thank you. Folks so interested in it that this nonprofit, Mind OC, actually got the award for being the nonprofit of the year in California for 2019, after only being in existence for 1 year. I went up to receive the award with 100 other organizations. And actually, did you know, Tibet, in California, there are over 70,000 nonprofits entity. And each year, the legislature in California would nominate a few nonprofit that they believe in, and then the legislature altogether would vote, and they select about 100. So when I went to receive the award, I was the infant in the room. Most of the other organizations been around for 20 years, right? So when it come to Mind OC, I said, we've been around for 1 year? And people look at us like, what? How did you get the award, right? So when we talk about what we wanted to do, they go, oh, okay then. So I'm very proud of that. But of course, it's not my work. It's Steve's work. It's Helen's work. Helen's been with us since day one. She owns Be Well. So if all of you ask me who owns Be Well, there are two owners, big one. Well, if Min represent the county, then Min also own Be Well, right? So NAMI owns Be Well, Jembry owns Be Well, and the county owns Be Well. Okay, so you get the gist of it? And I think the city of Newport Beach has not been coming to the meeting yet on a regular basis. Now Natalie will be coming. So you all heard Joyce. Natalie will now represent the city of Newport Beach, will participate in Be Well, so that Newport Beach can claim that Newport Beach also owns Be Well. Is that good, Natalie? Is that good with you? That will be in your job description, all right? So I will give Joyce input on how many meetings she shows up, so then next year when your performance eval come and you need a raise, I will support that. Thank you so much. All right. I'm on your side, Natalie. Okay. So there's 6 results that we wanted to do. The first thing is reduce stigma. The second thing is prevent and act early. The third thing is close the treatment gap. The fourth thing is improve crisis care. Fifth thing is build hubs, wellness hub in Orange County. And the sixth thing is align policy and what have you. So entity has been coming together and organized as such, okay, and produce a plan of actions last December. I'll tell you, we have quarterly meeting with the community, and each subsequent community meeting, the number just exploded. In the beginning, Helen, our first community meeting, there was 15 of us. The second meeting, there was 50 or less, and then 100. The one in September of 2019, there was over 200. This last one in December, it was a little bit over 300 individuals representing over 150 entity participated in. And every day I've got people call me and said, I'm interested, I wanna come in. We have an interfaith, right? So the Orange County Catholic Diocese is part of Be Well. Saddleback Church is part of Be Well. The Jewish Federation is part of Be Well. And then in last meeting, the Buddhist Association showed up and said, we want to be part of Be Well. Isn't that amazing? Not only that, we have been presenting the motto of Be Well to other places. I've been invited to Texas to present our motto. I've been invited up to LA, San Gabriel area to present the motto. I've been invited to Alaska to present our motto. And then our board chair have been invited to New Mexico to present the motto. Folk from Chicago has come down to Orange County to look at our motto. So we're spreading like wildfire. No pun intended. It's just because people are very interested. Okay? So I'm very proud of the work that you all did. Thank you, Helen. Thank you, Steve. If Jeff is here, I would say thank you, Jeff, because we really need those leaders who believe in this to drive the community. But I also would say thanks to the individual consumer and family member who've been participating in all the result work, because it's very important. This is the first building because, the movement is fine. Everybody believe in it. The academic folk will believe in it totally. So, Dr. Snow, I hope that you bought into this already. But really, you have to have something sexy to show people. So that's where the hub came in, right? So we broke ground on our very first hub in Orange. So that's our North County hub. We're envisioning that we should have 2 more hubs in Orange County, one in South County and maybe one in coastal area. Why we came up with 3? Because we figure the number of people who need crisis throughout a year span, and we figure if we build 3 hubs that would each meet a third of that needs, then we are pretty good, right? Now, I'm in the business of working myself out of a job. I'll explain what that means. When I worked for the health plan, LA Care or Optima, health plan always say, yay, the number gone up, our membership gone up. It means more money coming to the health plan. And I'm always the only one who said, no, that is sad. We should celebrate when people no longer meet the criteria to get public funding, because it means that they are doing well. We should celebrate when people do well, not when they do so poorly that they need government services. Does that make sense? That's the wrong way in celebrating. The more people who qualify for Optima mean our community is getting poorer, right? So the more individuals in our community no longer qualify for Medi-Cal and they can be on their own and have private insurance, that's when we celebrate. So we ought to be working ourselves out of a job, not more job. And I say that. And in the beginning, health plans like, what do you mean? And I said, that's exactly what I mean, right? So our goal is to make sure that these buildings get built, get services. 5-10 years down the line, nobody need to get services, because nobody would ever get to the stage where they're in crisis. because we have done enough upstream work to prevent people from getting to crisis. Does that make sense? That should be the goal, okay? So I'm on the path of getting myself out of a job, okay? So, but that those who know me professionally have changed job for the last decade. My mom said, you go in the wrong direction. How is it that you can't keep a job long enough? Every time I turn around, you get a new position somewhere. And it's like, yeah, Mom, that's why I still have my therapist. And then she go, well, maybe she's not doing a very good job. You need to change therapists. So the Be Well journey to date is we have quarterly meeting I told you about, work group meeting. We reviewed the blueprint in June of 2018. We had a summit where we brought who's who in mental health in Orange County, 200 individuals together in a room to talk about this plan. We got the result meeting. We have the Be Well Youth Committee meetings that was happening. Building one regional wellness hub. We started that already. We currently have a community suicide prevention initiative. We have a community suicide prevention forum monthly meetings. We have a substance use disorder initiative that we started late 2019. And we are now embarking on building a youth leadership academy where we will start them young at junior high level, carry them through high school and college. And we've gotten several colleges interested in, for those kids, I'm calling them kids, I'm not that old, trust me, to go through the academy, get early admission to these colleges. So we're on the way of building this. We believe that this is the best way to build youth leadership as well as build a mental health system of care. And the reason being, folks, I tell you, if everyone in America tomorrow raised their hand and said, I have a mental health condition, inclusive of substance use disorder, and I need treatment, we will be in deep trouble because there is not enough workforce to respond to the need. So University of San Francisco last summer issued a report that was commissioned by Janet I can't say her last name, the president of the UC system, yes, and Governor Brown and the California Healthcare Foundation, looking at the healthcare workforce in California, and one segment of that is specifically looking at the mental health workforce, and the outcome is not that good. It's saying that we do not have enough workforce to meet the demand in 2020, which is this year. Gosh, we're already almost a month past 2020. Time flies, right? And so in order to build this system, the question has always been, oh, that's nice, but who's going to provide the care? Right? We traditionally only relied on the licensed professional like me with title behind, and like them, they have title now behind their last name. But we seem to forget that the people who take care of individuals with mental illness and substance use disorder are actually the family and loved one that live with them. Because at most, anyone with mental illness could see the therapist 60 minutes, or 50 actually, a week, and then a psychiatrist for 15 minutes a month. The rest of the time of their life, they've been taken care of by their family member. Right? And so Orange County actually embarked on developing a new class of professional, and we call those our people with lived experience, put them through a training course and certify them as peer. And that's where I'm going to stop and pass the baton to my colleagues here who are trained peer, professional peer. So, and then I'll be available for the conversation on the panel too. So thank you.
Hi. Thank you, Dr. Chow. Wow, this is quite an experience. It's an honor to be in front of you all. And actually, I'm sitting next to two people, and there's not many of these people, two people that were actually around when I was taking my first steps in my recovery journey. So it's nice to be with you and be on a panel. I never thought I would be doing something like this. I normally haven't gone out and spoken a lot about my lived experience, but I guess, so bear with me. Today is one of those, first times. So yeah, Dr. Chow was talking about the workforce that's comprised of people with lived experience, right? So when we say lived experience, it could mean people that have direct lived experience as consumers of mental health services. And also there's those that are caregivers, family members, parents, spouses who support a loved one with mental illness. And in the past few decades, we all know that the recovery model has become the dominant paradigm in mental health policy and practice, right? So what we realized is that the system, not only the clients that are being served, but the system also benefits from those that have lived experience. So for example, a SAMHSA, our Federal Health and Human Services Department's Substance Abuse and Mental Health Administration, they say people with lived experience are important to be part of the public mental health system. They can provide input to the system on how practices and policies may be improved to be more recovery oriented. And I totally believe this, because as a person with lived experience, I have seen the system not as a consumer, but as somebody who works in the system. So most of my experience receiving services has been in the private world. So my idea of the public mental health system, I didn't have an idea until I started working for the county. And while I was a peer support specialist, I started recognizing a lot of things in the system that really needs to be worked on. So that was my driving force. Went to school, decided to be a macro social worker, and my dream was to actually work in the Mental Health Services Act office at that time. So I approached our Mental Health Services Act coordinator, and I had like a 1-hour meeting with this person. And then at the end of this meeting, I said, I would love to work for you. That would be great. And then like the next week, he called my boss and asked me to transfer to him. And that's Dr. Jeff Nagel, who's now our behavioral health director. So a little bit about my lived experience and how I became a peer support provider. So probably starting at the age of 15, 16 is when I first had really, really profound episode of depression. There were a lot of things going on in my family. We had some family crisis at that time. My parents had brought all of their life savings to America to start a business, and then they ended up running into a fraudulent con artist. So they literally lost all of their life savings. And during this time, I was, just a 15-year-old, right? But hearing arguments every day, like your parents in a poor mood all the time, and it was just not a healthy environment. And before I knew it, I was not feeling good. And I didn't know what that was. And to be honest with you, this was in the 90s. And I don't know if you guys all remember, but there was a commercial on the TV, and it scrolled down all these symptoms of depression. And it said, do you experience any of these? You might have depression. And so as a 15-year-old, that's how I found out that I had depression. So I started receiving services, and throughout high school, and even in my 20s, it was obvious to me that the services and the treatment, the medication wasn't working. It was later in my 20s that I realized this is maybe not depression. So as I looked more and more into it, and I started talking with my family members who probably have observed things more than I have, so after a while, we were starting to think that this is actually bipolar disorder. And later on, that was the diagnosis that I was given. And so even at that time, initially, I was very hesitant to receive mental health services because during my high school years and in my 20s, the treatment that I got actually didn't help me at all. It actually, I felt more destabilized taking what they prescribed, which were a bunch of different antidepressants. So even though I knew I had something that I needed to get help for, I wasn't comfortable because the previous times that I tried didn't work. So yeah, that was my life at that time. I had just left my job, and I was probably getting high or drunk every day. And one day I woke up in a hospital at the UCI Medical Center, and apparently I had driven drunk, and I woke up in the hospital with 7 of my vertebrae fractured. So that was quite a shocking time. And it was during that year, about 10 years ago, it was during that year that I was recovering, not just emotionally, mentally, but physically as well, and also spiritually. Somehow I was lucky enough to come into contact with people who said, hey, there's this training. They want people that have mental illness, they want to train you guys, and they want to employ you. And I was like, what the heck are they talking about? You know, how can I help anyone when I can't even figure my thing out, right? So at that time, I wasn't doing anything. I was just recovering, basically physically recovering. But that opportunity turned out to be probably the biggest opportunity of my life, because I took this training, and I can tell you that it was life-changing. So to being in a classroom of like 50 other people who are people in recovery, and to be honest with you, these were folks that were further along in the recovery. And a lot of these people had really, really severe mental health disorders, way worse than me. And when I saw these people able to come to class for 4 hours a day, 4 days a week, for 18 weeks, that was pretty inspirational. Not only that, the instructor that taught us, she was a peer herself that has been clinically trained. That was huge. This person who taught us took away so much of our shame and stigma that we had. And I can't explain this to other people who are not peers. And this is something that I feel like when I talk to people, only peers understand the value of being taught and seeing a model in recovery. I think when I try to explain this to people who don't have lived experience, they don't quite understand. But I saw the value of just being around people in recovery. They don't have to come and interact with you or even socialize with you. When you see like 50 people around you in recovery, and still have a lot of hope and strength, like that really changed my life. So upon taking this 18-week county-funded training, I actually joined the county as a peer support specialist, and I loved doing it. But it was during this time, I talked about this previously, where I saw so many things that didn't seem right to me in the system. And I still feel the same way about the system. And that's not to say that I want to talk badly of my employer. I think this is something common across all public mental health systems. So I think even though we recognize the recovery model as the one to follow, and our policies are based on the recovery model these days, I think the practice of applying the recovery model is still behind. So this is what I saw at the clinics. Psychiatrists and clinicians telling clients that, oh, you're not employable, don't even think about getting work. And this would drive me crazy because I know the value of work and I know what a meaningful role in the community does for a person's recovery. In my opinion, these things, employment, education, having a safe place, these things are actually even more important than the treatment from the professionals. Because I think if you improve your life in those domains, your symptoms and your impairments will go down. You try to treat that with medication alone, it's not going to work, and it's going to be very difficult. So I still feel there's so much that needs to be done in the system where we value services that look beyond the traditional treatment, a more holistic approach where we help people sustain their recovery out in the community. Because no matter how often you go to the clinic and see the professionals, at the end of the day, you have to come back home into your community and live life. So in my opinion, those things are super important. What else do I want to talk about? Yes, the peer workforce. Going back to the peer workforce, I know that we might be short on time, so I'll just try to wrap up really quick. So in my opinion, the way a system integrates the peers into the workforce, it reflects how the system feels about the people that we serve. And through my experience working with our peer workforce and trying to integrate them into our traditional workforce has been very challenging. A lot of the things that you see that clients face, our own peer workforce also face. And I don't know if people make this connection, but it's so obvious to me. It's almost like a temperature, a recovery thermometer that shows me how recovery-oriented we are. And in my opinion, we still have a lot of work to do in that regard. Also, another vision of mine for the peer workforce or the system itself is I want every provider to serve clients looking at or holding the hope that maybe one of these people could be a peer supporter. To me, that's a model, that's a cycle that can continue to feed itself. You train one peer provider and you inspire another person to get into recovery, that person might also be interested in becoming a peer provider themselves. So it could be a never-ending cycle. So these are some of the visions that I have for the peer workforce and our system. It's kind of a dream that I was a nobody in a hospital bed who hadn't even taken a step in the recovery journey to now find myself advising the behavioral health director, sitting next to Dr. Chow and Heidi in a room full of people who want to know about mental health. It's great, but at the same time, I want to tell you that recovery isn't easy, and recovery for someone like me who has a chronic, serious mental illness, it's something that I have to live with, probably for the rest of my life. So I can be vulnerable right now, and tell you, even though I may look okay and I may look functional, there are times, I would say in the past few months, I think I'm actually experiencing some of my most severe depression. I actually saw a psychiatrist today for an hour and 30 minutes. What was interesting was that I was actually educating her more about me and the things that I've learned. I was teaching her about harm reduction. I was teaching her about a therapeutic range for lithium and how it looks slightly different for Asians. This is what I learned. So I learned that the more you educate yourself, and psychoeducation is key to removing self-stigma, the more you educate yourself, and when a provider sees that, they respect that. And even though you may not be following the traditional approach to treatment, I feel like when you are empowered enough to direct your own recovery, great things can happen. And I do want to send a message to people who provide services. Your role is actually not the expert. You are in the position to help the one you serve become the expert in your life. So I see so many people coming out of school thinking that they're experts and they know what to do. And I really want to change the way people think about that, because really for recovery to be sustained, you have to let that person become the expert of their lives. That's all I have to say from my part. And I'll send it over to Heidi.
Thank you, Min. My name's Heidi. I'm going to talk to you a little bit tonight about my journey with mental health. I'm a peer specialist like Min, and I kind of had the same experience as Min as a teenager, except I was on the opposite end. I didn't have depression. I had what they call mania. I was always on the go, really heightened. I was an overachiever. I didn't sleep a lot. I was very active, but in a non-productive way, I'll say. And that led into my early adulthood. I went to Cal State Fullerton and worked full-time and partied at night and just didn't sleep a lot. And that led on to, I got married at 25, and 6 months after I got married, I had my first complete manic episode, which landed me in the hospital, and I was diagnosed bipolar. That would start 7 years of utter chaos in my life, which would just different legal problems and interactions with jail and what we call collaborative court. I don't know if you guys know what collaborative court is, but that's a court system we have for mental health and drugs and alcohol. And I had a drinking problem, and to go along, I was self-medicating. I was involved in what we call collaborative court, whatever it takes, the WIT program. And for 7 years, I just was one problem after another. My husband at the time was getting his graduate's degree and working full time, and he didn't know what was going on, and he didn't understand mental health. And so he just kind of was like, I'll just let her deal with this and kind of give her money, pay for whatever the problem is, and that's how he dealt with it. So I just really ran amok for 7 years until I got a probation officer that, to this day, is a good friend of mine that saved my life, basically. What she did is she talked my husband into basically tough love, locking me out of the house and putting me out on the streets. And I was homeless for a while. And then my probation officer found me and told me that I was turning out just like my mother. My mother is a alcoholic drug addict, and when I was born, she left right after I was born. So that was like the bottom for me, and that was like my aha moment. And I said, okay, I'll get the help I need. And that was the start of my acceptance to my mental health. When I was diagnosed, I was I had this grandiose attitude, and I had this, I'm not sick, everybody else is, you know, and I don't need help. And so that was the start to my journey with recovery. I did spend a lot of time in the hospital. I went to a long-term hospital in Mission Viejo, and I spent quite a long time there. And then I just a lot of time in therapy. And at the time, we didn't have a lot of services in Orange County, but I was lucky to get the bit of services we did have. And I will say, in the time, you know, the time that has lapsed, we have tremendous amount of services now compared to what we had back then. The system has come a far way. I will say that NAMI OC was a tremendous blessing to my husband. My husband didn't understand what was happening with me or mental health. He did turn to NAMI OC when everything was going on, and they led him to family and guided him through the crisis. And that really, you know, saved him. You know, today I will say that, you know, I took 7 years of his life away in our marriage, and that's really hard for me. You know, and I just, you know, us individuals that have mental health and go through crisis, you know, it's just as hard on our family members and the ones that take care of us and that love us and that stand by us. You know, they're going through crisis too. They're going through it right along with us. And it's not just our battle, it's their battle too. And we're lucky that we have them. And, you know, even if it's your neighbor, it's your boyfriend, girlfriend, you know, we're lucky that we have that support system. You know, I've been able to come a long way in my recovery. You know, it hasn't been easy. You know, there's ups and downs, there's setbacks, there's, you know, my road to recovery has been, I've learned a lot about myself. I've been able to, you know, find hope, have lots of dreams, you know, learn things that I didn't like about myself and things I do like about myself, and just be really open to who I am. And I've been able to take my mental health and help others, and that's what's most important to me. I was able to go back to school and get my master's in social work, and I'm a peer specialist too, and just to be able to use my experience to help others. And you know, I have I did some hours at the Friendship Shelter in Laguna Beach, and I had one individual that came in off the streets. He was homeless, and he was deep in addiction, and he was really down and out. And my lived experience, he related to a lot. We related to each other, and he was able to relate to me and be able to get services, and we were able to just connect, and I was able to help him through. He got housing and a job and reconnected with his family and his daughter, and you know, so that was a blessing, just to be able to help, you know, that one person, you know, makes a difference to me. I guess that's what I have to share. Thank you.
question and answers if people would like to ask our panelists anything.
I'd like to make a comment.
Yes.
Yeah, so Dennis Bress, Newport Beach, thank you so much for putting this together. Wow, be well. How fantastic. This is great news. I'm impressed with what the panelists had to say. Congratulations on your journey. We're all in our own journeys, right? So we just got to keep moving forward. That said, so is the building being built, the first hub, in Orange? So have you guys already broken ground?
Yes.
Yep, and when is that expected to be completed?
So it should be completed sometime, I think this is on. Sorry. Yes, so it should be completed by sometime the end of this year, and we are hoping to open the door for services by January 1st, 2021. So.
Could you tell us more about what the collaborative court is? And also, I heard something by Don Barnes talking about how the jail system in Orange County is could be part of the recovery movement, and I'm wondering where that stands. I thought there might have been some court challenges or something.
So the collaborative court was actually a community movement, a collaboration between the Superior Judge, Superior Court, where a judge was specifically assigned to it. Then the DA has to participate in it, and obviously the public defender and the probation office have to participate in it. And then on the treatment side, the County of Orange have been participating in that as well. So what it is pull different courts. There is the veteran court, and I've not been part of that, even though I was the original developer for that court with Judge Wendy Lindley, if you all remember her. I've not been involved, so I don't know how many courts currently exist there, but I know at least 3 courts are part of that.
Yeah, the homeless court.
Yeah, the homeless court
the
now.
drug and alcohol.
Drug court.
DUI.
We call it the dual diagnosis
Yeah.
court. And then also the most important piece that we're very proud of is the veteran courts. In fact, that was the second veteran court in the country and the most comprehensive court in the country. We used to be the training sites for other jurisdictions in the country to come and learn. The beauty about that is we built it so it doesn't look like a courtroom. It is actually on Main Street. A very friendly environment, and while the judge is holding his or her court, there are social services, NAMI, public health come on site to provide whatever services that the individual participant would need at that time. And so I used to be the psychiatrist that providing treatment for those who weren't connected to the county or did not qualify for services at the county and did not have insurance to have access to psychiatric care. So I used to be the psychiatrist, as well as providing the evaluations in terms of accepting people, assessing whether or not they are appropriate for each of the court. So it is a model, and I'm very proud of Orange County because we started that. So that's answer your question. The other piece is Sheriff Barnes is a mental health advocate way before he was elected into his current position. Sheriff Barnes has been participating in various boards of entity or agency that provide mental health services. So when he got elected, he really did an overhaul of all the sheriff department. And the first thing first is that he ensured that all of the sheriff get trained on crisis intervention, right? That's really important. What he has observed is that there are people who would come into jail that under his jurisdiction, they would just sit in jail and not getting treatment, right? And then when they get released, they get referred to the outside services, but sometimes it's very difficult, or most of the time it's very difficult for people to navigate the system. And what he'd like to do is, while they were under his jurisdictions, ordered by the court, he wanted to do something. He wanted to at least start treatment and then ensure that there's a proper transition when they get discharged. One of the significant things he did was, usually jail, any jail in this country, once the judge order for you to be discharged or sent out, they'll send you out. And most of the time, people are sent out in the middle of the night. So you know that. I mean, you can imagine if this is someone with mental illness and homeless and you discharge them in the middle of the night, there's nowhere for people to go. And if they are involved in addiction, they're being preyed on because drug dealers are readily receive them, the first one to receive them the minute they leave jail and they go back to the bad environment. So what he has done is that he does not allow his sheriff to release people after midnight. So now people who get released in the morning, and they're directly released to a clinic, because if you release them in midnight and you tell them to go to a clinic for treatment, there's nobody in the clinic to receive them, right? So they usually release people around 8 o'clock in the morning. That's when the clinic starts. So proud of him. Apparently, we have all misunderstood that, oh, the minute the judge releases you, you have to release people. By law, there's a 24-hour period where you can help people and not release them into the cold. And so he exercised that. So he's done a lot of good things. As far as building the treatment, I know it's very controversial because people who said, well, we don't want mental health dollar to spend in jail, we should be building the system. And I see both sides of the coin, but at least when people are under a captive audience, I'm going to put it that way, something must be offered, because you would miss that opportunity if you don't. Okay, if we are able to provide schooling while people is in an institution, why can't we provide treatment when people are in the institution? I don't understand that piece, right? So instead of having people sitting idle and miss that opportunity, we would allow and go against that. And I guess we have to find a balance, but both my colleague on my side, they are, talk about how there are a group of folks who are not willing to get treatment, right? But if you get them in a situation, in an environment where you provide that hope, maybe they would readily accept treatment. And we know that's true. So I know it's very controversial, right?
Yeah, and if I can add to that, we're actually employing forensic peers, people with lived experience of incarceration, helping some of these people that are getting released get linked to the right services. And something that Dr. Chow just said about that I want to tie some peer stuff into is that when there are people that are also recipients of mental health services helping another consumer, it actually research has shown that it increases engagement in treatment, it decreases self-stigma, and there's a whole slew of good outcomes when you do pair up people with that are going through similar things. Yeah.
And this is not difficult science. We've done this in other area. Cancer, I'm going to go back to that. If you go to City of Hope and you are just newly diagnosed with cancer, there are a group of people who've lived through the cancer and the treatment readily there to help you, support you, and walk you through it. It's not that hard. is not difficult science. It just makes a lot of sense, right?
Yeah, I just wanted to say thank you very much. And very informative. Dr. Chow knew something about Be Well, but not as much as I learned tonight. And your observation about the silos, but the lack of systemic connection between them is also applicable to looking at how homelessness has been dealt with in the county for years, but we seem to be moving forward towards more systematic connection.
Great.
That's an important observation. And Min and Heidi, thank you so much for sharing your journeys. And it's great to see you where you are right now, and congratulations. I did have a question or a concern. Dr. Chow, you indicated that the term mental health may disappear and be replaced by the term brain diseases. As a sociologist, I find that concerning for two reasons, because it over-medicalizes mental health and it decontextualizes it. And Min's observations really speak to that, because he talked to kind of juxtapose some of his experience in counseling, but also what he got out of work and other life experiences. And those are the social contexts. And I don't know how you separate the two, that is, certain things that are going on in your mind and brain from the social context, because we're all embedded in some kind of social context, and some are more supportive and some are less supportive. So to call it just brain diseases seems to really alter how we think about and how we understand and how we experience mental health issues.
Sure. So the good way of answering your question would be, if you got a broken bone today and you walk into your doctor's office, the doctor or whoever not only give you a cast, but you got a bunch of other instruction in terms of rehabilitation. You got to exercise, you got to do certain things. The medical procedure is not the only thing. If you have high blood pressure or diabetes today, the answer is not just the medicine, but you got to do a lot of other behavior changes. Watch your diet, do exercise, do meditation, do yoga, because all of that prove that it helped your medical condition. I think I entered the field right at the purposes where there's this whole notions of medical approach versus social approach. To me, it's a combination of all approach to medical condition, right? I'm not advocating for one or the other, but the issue is not recognizing mental health condition and substance use disorder as brain disease. We're implying that a person changed their behavior and everything's okay. I find the term behavioral health very problematic. So imagine as a young family with a young child just have symptoms and you go to the primary care physician and seek help. Your pediatrician said, take your child over to the behavioral health department. It implies that if you change your child's behavior, everything's okay. It's blaming on the character of the individual rather than understanding that it is a brain condition. It warrants treatment, not minimally adequate treatment, but full treatment, just like any other medical condition, which could include medicine and other social determinant approaches to care, right? So job is also important, because for a woman with breast cancer and need to be treatment, you got to modify your job environment. It's also important, right? You got to lower your stress level. It's also very important. And most of the time, because of the medication you take, you got to modify your diet. So it is not about a medical model versus a social model, but looking at a person as a holistic and using holistic approach and understanding that it's not the person's fault that the person has addiction or mental illness. Frankly, generally, most people in America, not me, I have to clarify that, have dabbled into drug and alcohol. But why does it, for some people, it become an addiction, it become a condition that they struggle, and other is not? It's because very similar to people who smoke, many develop lung cancer, but many don't. I can't tell you what happened, right? But if your genetic risk expose you to develop a condition, well, we have to accept that it is a medical condition, not to stigmatize people and say, well, you behave that way because of your personal characteristic. I mean, is that correct or no?
And if you look at what's been done around the world, when they stop looking at it as a criminal offense and treat it as a medical condition, substance use disorders have way better outcomes. In our county and in our country, we're not doing that, but if you look at the more of the progressive countries, you will see that their way of looking at it as solely a medical condition has resulted in the best outcomes.
We have time for one more question. Thank you.
Just following up with what he said. Can you hear me?
Yes,
Is that
ma'am.
on? If it's a medical model, then wouldn't, like now, a psychiatrist is the only one that can call somebody bipolar or whatever, and then refer to a psychologist or a counselor. So if you were going to put everything under brain disease, would that mean that a psychiatrist would have to be the one person that would refer it?
No, ma'am, that's not how it works, because even licensed psychologists can diagnose. Under the current regulations, actually, a licensed psychiatrist, a licensed physician, a licensed nurse practitioner, a licensed psychologist can give a diagnosis and get reimbursement. But out of the public side, on the private side, even a licensed social worker could diagnose and treat someone. People might say, well, if it is a medical condition, then the only thing they need is medication. That is not true. I tell my colleagues that there has been a lot of research shown that the human interaction, the therapy piece of it, actually changes brain structure. We know that. We have proven that. So it is not to discount the talk therapy. In fact, talk therapy is very important, right? We have demonstrated that individual therapy, the relationship between the therapist and the patient actually changes brainwave and brain structure. So these treatments actually work. But these conditions are brain conditions. There's no denying about that. We can't deny that these conditions are brain conditions. That's how we're going to change the stigma for people who purely have addiction. Right? It is not because of the character flaw that they become homeless because of addiction. It's a brain disease. We know that. We have tons of research proving that. So stop blaming the person and start getting them into or engaging them into treatment. And let's get better. That's the bottom line.
That was a very appropriate way to end our conversation this evening. I thank you all for coming. This one's working. Yeah, the City of Newport Beach is going to be having another community event in February. That one will be specifically youth homelessness issues. We have Project Hope Alliance coming. That meeting will be in the library in the Friends meeting room. It will not be in this room. And the details are on the website. And as a reminder again, we are filming this for NBTV. If there are people in your lives that would like to watch it, it should be posted in about 3 to 5 days. And thank you all again for coming.